Karen Stockwell.
And I'm Jonathan Dubin. We are the 2013 Georgia Mission of Mercy co-chairs. If you're planning to attend GMOM as a patient, this video is designed to give you an idea of what to expect and how to prepare. The Georgia Mission of Mercy is a 2-day free dental clinic that will be held at the North Atlanta Trade Center in Gwinnett County.
This free dental care is made possible by hundreds of volunteer dental professionals, medical professionals, and general volunteers, as well as donations of money, supply, and services by dozens of sponsors and local businesses. Our purpose is to provide free dental care on a first-come, first-served basis to as many adults and children as time, volunteers, and supplies will allow. We're here just for you. We want this to be a good experience, and we hope to give you the knowledge, tools, and resources to help you stay on track for good oral health in the future.
Our goal is to serve about 1,000 patients a day, but we can only accomplish this with your help. We need your cooperation and understanding as we attempt to operate as efficiently as possible so that we can help as many people as possible. You can visit the patient information FAQ area at www.georgiamissionofmercy.org. You will find more detailed information about what to bring, where to park, and what to expect. Much more than we can cover in this video.
Before you go to the effort of waiting in line, we want to be sure you understand what services the mission can offer. We offer cleanings, fillings, and extractions. There are only a limited number of root canals available and only for front teeth, and again, very limited lab services. Please be aware that the clinic is run on a first-come, first-served basis. Doors will open at 5 a.m. on Friday and Saturday. After about 1,000 patients, the doors will close for that day.
At about 5 a.m., volunteers will begin leading patients in groups of about 50 inside to begin the patient registration process. Here's what you can expect once you enter the building. The only people who can enter the clinic floor are patients and the parents or caregivers of minor children who are patients. Family members and friends who are not receiving dental care will be escorted to the family and friends waiting area. There is just not enough room on the clinic floor for everyone to stay together. If more than one family member is receiving care, you're not likely to stay together once your treatment begins, and you are not likely to be finished at the same time either. So after your treatment, you'll be led to the family and friends waiting area, where you will all be reunited. Simply be sure everyone knows in advance that the plan is to meet up in the family and friends waiting area after treatment.
There's no possible way we can tell how long your treatment will take. There's just too many factors involved. Therefore, you should come prepared to stay for the entire day. That means to bring a full supply of your medications for the day and any baby supplies you might need. And don't leave these items in your car. All children under 18 must be accompanied by a parent or legal guardian at all times. However, only one parent will be allowed to accompany the child onto the clinic floor. Parents who want to receive dental care and have children who are also receiving dental care will be kept together. The child will be treated first. If you have a disability and require the aid of a caregiver, that individual will be allowed to stay with you throughout the day. If you're acting as a translator for a patient, you'll be considered as a caregiver and allowed to stay with the patient throughout the day as other family members and friends go off to their waiting area.
Parents, we're sorry, but the fire marshal will not allow strollers on the clinic floor. We know this is inconvenient, but that is the fire code, so there will be no exceptions. After you register, you'll be helped every step of the way by volunteers called patient ambassadors who will seat you in the order in the patient waiting area. Now here's another thing where we really need your help. No patient should ever walk around on the clinic floor without an escort, as this is for your safety.
After you've completed registering, you'll be escorted to patient education first and from there to medical triage, where you'll have your blood pressure taken and your medical history will be reviewed to be sure it's safe for you to receive dental care. Some things that might prevent you from being treated include having a fever, uncontrolled blood sugar, high blood pressure, or a history of excessive bleeding. Next, an x-ray will be taken to aid dentists in examining your mouth. In the exam area, treatment options will be discussed with you. It is likely that we will not be able to take care of every dental need that you have today, so you and your examining dentist can decide what's most important to you and your oral health. Once your treatment priority is established, you will be escorted to the waiting area for the treatment you'll be receiving. If you have been prescribed a medication, it will be available for you in the pharmacy area free of charge. Please note, no narcotics will be on site, and if given a prescription for a narcotic, you will need to fill that out at your own expense.
Once your treatment is completed, you will be escorted to a checkout area where volunteers will give you important follow-up information regarding your dental care and answer any questions you may have. You will also be invited to fill out a comment card about your GMOM experience. Your candid answers will help us improve future GMOMs. You'll also receive a bag with dental care items and a list of area low-cost or no-cost dental care clinics and programs all across the state. We hope this gives you a good idea of what to expect at GMOM.
And we look forward to serving you and helping you achieve a healthy smile.